From anatomy to anesthesiology, from pathology to pharmacology, from microbiology to medicine, a one-man resource to the world of health sciences. Welcome to Dr. Paul's Medical Lectures. A practicing physician, Dr. Paul offers you essential insights on diseases afflicting millions of people around the world. For today's lecture, here is Dr. Paul.
Good evening, folks. This is Dr. Paul. Thank you very much for tuning to our channel today. This evening I want to talk a few minutes about aging. You see, if we live long in this world, we will get old and we die. So aging and death are important medical factors, and we should never neglect that. Many times we just neglect the elderly patients, but the fact is, as the longevity increases, we have increased the burden on our shoulders to take care of these people, especially in terms of health promotion. Health promotion is basically improving or enhancing the individual's current health status. So the purpose of health promotion is especially for the elderly. You need to prevent. The prevention is very important. How can you prevent the decline, the frailty, the dependence? Those are the important factors as physicians. Now, frailty is emerging as a new geriatric syndrome in recent years because we have to take care of these elderly people, and it is multifaceted. And anywhere from an elderly person living independently to the person who is dying, all this area encompasses the geriatrics, and we need to take care of those issues. So frailty has been associated with many conditions, and there are many reasons. I mean, you take for example an individual who is almost falling, like falls, is losing weight, or he has cognitive impairment, or he has certain things like depression. So can you prevent them? Yes, if you recognize them, you can prevent them. So we need to identify the frailties and then to treat those frailties. Those two tasks are associated with each other. So the advanced age, especially people who are like 85 years old, they are more prone to falls. What are you going to do to prevent the falls? And they're more likely to be on polypharmacy, taking more than 2 or 3 medications and the side effects they have to deal with. And they're more prone to have a chronic disease like diabetes or heart disease. They're more prone to have dementia, losing the memory and the impact of dementia on their life. And they're also more prone to depression because they are just stationed in an institution like a nursing home. And as they are institutionalized in a nursing home, they become more prone to infections like MRSA. And also elderly abuse is another factor we need to consider. They're also more prone to nutritional impairment, developing vitamin B12 deficiency or folate deficiency. You see the factors they are exposed to as they get older. And as physicians, we need to know what is happening in their lives. And what can we do to prevent the falls, for example? What can we reduce the polypharmacy? Can we reduce the medications in order to decrease the range of side effects? That is important thinking. And if we are hospitalized, what are they going to be vulnerable to? And how is their nutrition? Are they getting enough nutrients? The other thing is preventing the major causes of death in old age. Number one is heart disease, and then comes the other diseases like cancer, then lung disease. So number one is cardiac disease. Number two is cancer. So heart disease, like 47% of the causes is Heart disease, what are you going to do? Then cancer, are you doing screening? Then stroke, how can you prevent stroke? Then lung disease, and then falls, how can you prevent falls? Then diabetes accounts like 2% of deaths in this age group. How can you prevent diabetic complications? So you see, just having that knowledge helps you to take a better care of these patients. I mean, the 5 most important causes of death in this age group, I mean, you should know about them, and you should think about those 5 things when you see an elderly patient, because you give a lot of preventive care to these patients. So you see, heart disease, cancer, stroke, and then comes lung disease. What are you going to do? I'm going to talk about vaccinations after a few minutes, and we are going to see how to prevent diseases using vaccinations in this age group, and using screening studies in this age group. How can we decrease the mortality and morbidity in this age group? So you see, the vaccinations, the screening, those are all important, folks. Now let's see vaccinations. You have to give an influenza vaccine every year, then pneumococcal vaccine one time for those 65 and older, then tetanus vaccine every 10 years, zoster vaccine like every after 65. So those are the important vaccines. Influenza every year, then tetanus every 10 years, then zoster vaccine after 65. Those vaccinations are important. So those 4 influenza, pneumococcal vaccine, zoster vaccine, tetanus vaccine. These 4 vaccinations, they should be up to date. Then comes the cancer screening. Are they having colonoscopy screening? It's like every 10 years. Are they having breast cancer screening, mammography every 2 years up to age 74? And are they having colon cancer screening? It's like annual fecal occult blood testing, or you can do colonoscopy screening every 10 years. So you can also do other screenings, like are they prone to any lung disease? You can evaluate in terms of their tobacco use, blood pressure screening. Then other important point is abdominal aortic aneurysm, using an ultrasound screening between 65 and 75 in patients who have smoked. That's very important there. Between 65 and 75, you always screen with an abdominal ultrasound for abdominal aortic aneurysm in patients with a history of smoking. That's an important point there. So those are the screening tests you should know, and those numbers are important because they are given by United States Preventative Task Force. They are not brought up out of my mind. They are important numbers that come as questions. Now, you can also, there are individual things like osteoporosis and obesity, and you can always screen for those things, and you can try to bring down the weight, like in obese patients, for example. And you can also do medications like aspirin if the patient is like 45 and above. In men, you can use aspirin. In women, you can use aspirin above 55 to reduce the ischemic diseases like heart disease or stroke. But the patient has any tendency to GI bleed, then you should not use aspirin in these patients. So aspirin is also a part of the preventative strategies we use in the elderly people. And then diet, healthy diet to maintain good caloric balance and low in saturated fats. So a healthy diet is very, very important because you see, as I said, the nutritional impairment is very, very common in the elderly people. And you need to think about how to increase the physical activity in these patients, to exercise, and because you see, we know about primary prevention and the secondary prevention. Both primary and secondary prevention, they have important role even in the old age group, because it enhances their well-being. And the physical activity, yes, they increase that physical, and it gives them a concept of self-confidence, self-sufficiency. It increases their cardiovascular status, their functional status. It improves their well-being. So you need to think about increasing their physical activity besides doing all these things. You see, folks, there are many dimensions in taking care of these patients. First, we have seen frailty, the risk factors. The risk factors include proneness to falls, depression, dementia, and polypharmacy, the impact of chronic diseases. Then we have seen the most important causes of death in this age group and what should we do to prevent them. Then we have seen the 4 vaccinations that are important in this age group. Then we have talked about the screening studies for the colon cancer, for the breast cancer, and also for you can also actually screen for cervical cancer with pap smears. And there are specific guidelines you can follow from the website of American College of Obstetrics and Gynecology, and also using medications like aspirin. So you see that taking care of the elderly is a very important factor, and we often neglect that, and we always think like this guy is like 65, he is 70, oh, he is done, let me throw something, he's gone. This lady is like 80 years old, she doesn't have much time to live anyway, let me give something and get rid of her. You see, that's a very tragic approach to treat these patients, because the responsibility of the physician is to improve the quality of life irrespective of the age, and especially the elderly are more vulnerable, so they need more care in all the aspects I have listed today. Hopefully that helps you in your practice and in your examination. Thank you very much. Have a good night.
Thanks for listening. For more medical videos, please visit us at www.drpaul.org and take time to browse through hundreds of health videos we regularly post on our site. If you are preparing for USMLE, PLAB, and other medical exams, make sure you visit our website to browse through our videos explaining the essential points you need to know before taking these examinations. For more information, visit us at www.drpaul.org. Thank you, and may God richly bless you.